Welcome back. The Ministry of Health is seeking to assure the public that actions have been taken in the interest of containing the spread and protecting the health of staff and inmates at the Border Lake Correctional Facility after 9 tested positive for COVID-19. On Monday, the 25th of January, the Ministry of Health received notification that a corrections officer at the Border Lake Correctional Facility was diagnosed with COVID-19. The officer, having accessed care, was tested and placed in quarantine whilst awaiting test results. On Tuesday, the 26th of January, public health officials of the Ministry of Health conducted an assessment of the situation at the institution where the close contacts of the confirmed case were identified and tested for COVID-19. A total of 35 individuals were tested, which included 24 inmates and 11 corrections staff. Amongst the 33 individuals tested, 8 inmates and 1 staff member have since been confirmed as being positive for COVID-19.
In response to recommendations from the Ministry of Health and Wellness, the following actions have been taken in the interest of containing the spread and protecting the health of staff and inmates at the facility. Complete isolation of confirmed inmates away from the general population. Quarantine and testing of close contacts of the confirmed cases.
On Saturday, the 30th of January, samples were taken from a total of 86 individuals, 79 inmates, and 7 custodial staff. The Ezra Long Lab is currently processing these samples. In the meantime, Dr. DaCosta Gomez says infection prevention and control measures have been ramped up at the prison.
Enforcement of strict infection prevention and control measures to decrease the rate of transmission of the infection. That is, isolation of any symptomatic inmates, placing of exposed inmates into a limited number of areas, whilst establishing effective barrier controls between them.
Protective measures for inmates who fall into high-risk categories have been implemented, and the use of adequate personal protective equipment by healthcare staff and custodial staff has been ensured. Health officials say they continue to monitor the situation at Border Lake Correctional Facility and provide necessary support. Health officials say St. Lucia, like the rest of the world, is working diligently to access COVID-19 vaccines that are safe, efficacious, and of good quality. As a member of the COVAX Advanced Market Commitment Group, St. Lucia will benefit from vaccines to cover 20% of the population in Phase 1 of the distribution process, as the supply of vaccines are still limited. The focus, health officials say, is to ensure equitable distribution of the vaccines. The Ministry of Health has established a COVID-19 vaccine committee, which is planning and coordinating the rollout of the COVID-19 vaccine introduction and deployment in country. St. Lucia's COVID-19 vaccine deployment will have a 3-phased approach, targeting priority groups first based on the level of exposure and risk to COVID-19. Assistant Principal Nursing Officer Tekla Jabatis says in the initial phase of the program, when vaccine supply will be limited, 20% of the general population will be covered. Hence, the critical population will be targeted in the early phases of the program.
The target group includes inpatient and other high-exposure healthcare workers, high-risk first responders, police and fire, persons 65 years and older, persons in elderly homes and caregivers, elderly in the communities, and persons living with chronic, non-communicable diseases, prioritizing those 65 years and older, then those 16 to 64 years.
In the second phase, when supplies increase, the Ministry of Health will work with all stakeholders to ensure that all remaining Phase 1 groups are vaccinated and that those targeted under Phase 2 of the program also receive the vaccine.
These include persons of medium risk, healthcare workers, firemen, policemen, caregivers, international agency personnel, and persons with non-communicable diseases. During the third phase, when they will have adequate vaccine supply to cover the general population, the Ministry of Health and Wellness will focus on vaccinating the following target populations: low-risk healthcare workers, firemen and policemen, non-essential workers, and the rest of the population.
The ministry clarifies that to date, the Pfizer vaccine is the only one which has been pre-qualified by the World Health Organization. According to international agencies such as the Global Alliance of Vaccines and Immunization and the WHO, the regulatory process is in its advanced stage and will be finalized in the coming weeks. In light of this, discussions are ongoing regarding which vaccine or vaccines will be pre-qualified for the Caribbean. Notwithstanding, logistics are in place. The Ministry of Health says notwithstanding, logistics are in place to receive and deploy whichever vaccine is made available. It is expected that vaccines will be available towards the end of the first quarter of 2021. The opposition St. Lucia Labour Party is condemning Prime Minister Alan Chastanet for not updating the nation over the weekend following a NEMAC meeting on Friday. SLP Communications Officer Mondi Lewis has leveled accusations that the Prime Minister was instead busy campaigning.
In the absence of the live update to the nation, a press conference from the Office of the Prime Minister informed anxious St. Lucians that the expiring COVID-19 protocols would be extended for an additional 3 days. On the day when the country recorded its highest number of cases, 216, along with 2 deaths, and the expiring of the 10-day COVID-19 protocols, the disdain of the Prime Minister for the people was very evident. This, at a time when our healthcare professionals are overwhelmed, our citizens are frightened, and St. Lucians need hope. The government of St. Lucia continues to disrespect and fail the people. On 31st January, the latest 10-day COVID-19 protocols were set to expire. Citizens awaited an update to the nation, but instead were shocked by images of the Prime Minister campaigning in Choiseul, violating COVID-19 protocols. According to the prohibition of all social gatherings, in public and private settings, individuals are to limit their contact to their immediate households. While citizens are being patrolled and fined for breaking COVID-19 protocols, the Prime Minister continues to set a poor example and demonstrates his belief that he does not have to follow rules.
That was SLP Communications Officer Mondi Lewis. Meanwhile, UWP PRO Norbert Williams has addressed a statement by the SLP calling out the party for what he says is its continued desperate antics. He says the statement by the SLP is riddled with inaccuracies.
The United Workers' Party would like to make a clear and categorical statement that the SLP continues through a number of different mediums to try and confuse and mislead the people of St. Lucia. Prime Minister Alan Chastanet was on an observation tour around the island this weekend to witness firsthand the effects of the protocols on the people of St. Lucia and to distribute masks. There was never any intention or never was there any mass crowd event, and never did the Prime Minister create any situation which was in contravention to the protocols as they are established in St. Lucia. Prime Minister Alan Chastanet is the Prime Minister of St. Lucia, and he is able to evaluate the situation as it exists on the ground for the better of the people of St. Lucia. Rest assured that any changing timelines with regard to the Prime Minister's address to the nation are solely because of the changing situation on the ground in this global pandemic, and to consult with all stakeholders to get the pertinent information and to make the necessary recommendations for the handling of this global pandemic.
That was UWP PRO Norbert Williams. In other news, nearly 2 years after her son was shot and killed by police, Joanna Joseph continues to seek justice for his killing. Arnold Joseph, who died on the 22nd of May 2019, would have been 19 years old on the 30th of January 2021. On Saturday, family and friends converged at the junction of Chaussee and Le Pensée Road in celebration of Arnold's life. Genevieve Gonzague reports.
Happy birthday to Arnold. Happy birthday to Arnold. Happy birthday, happy birthday. Happy birthday to
Had he been alive, Arnold Joseph would have celebrated his 19th birthday on January 30th. On May 22, 2019, 17-year-old Arnold Joseph was fatally shot by police. On that fateful evening, Joseph was a passenger on a motor vehicle in the company of two individuals when they were engaged by police in a high-speed chase through the city of Castries. According to police reports, the suspicious vehicle ventured through one-way streets in the city, violating multiple traffic regulations. Nearly 2 years after his death, his mother, Joanna Joseph, continues her relentless quest for justice. On Saturday, family and friends converged at the spot where Joseph took his last breath to celebrate his birthday.
We trying our best, but some days are better than some other days are challenging. Like today, it's a little challenging, it's a little stressful, a little depressed, Sometimes you can't even explain it because it's something that he liked to do. He loved celebrating his birthday and stuff like that. So a day like today would be a day where he would be missed by many. Not only just by my family, but by his friends as well.
She says the family is holding out hope that some answers will be provided before the next anniversary of Joseph's death. However, the family is concerned about the impact of the pandemic on the progress of the case.
We get the same thing every time we call them. It's like they say investigation is taking place, and I guess the last time we spoke to them, they were saying that they're getting close to closing the matter. So right now we're just waiting on them to give us a response of what exactly is happening. So I don't know.
His friends say as they continue to grieve Arnold's loss, his birthday is a particularly difficult day.
How can I wish happy birthday to somebody that's not there? Check what I try and show you. So yeah, I could tell him continue zesting in peace, playing his mixes for the angels, and see it. Yeah.
Can I even spend it with him? Seeing like he gone, and I can even at least drink a little too with him or something, You get like I feeling. I even know how to explain it because I just really miss my boy. You check it, my bro. I'm on my bro from time. You check it. I did love me,
Arnold has been described as a loving individual who was loved by many.
Happy birthday to Arnold. Happy birthday to Arnold. Happy birthday, happy birthday. Happy birthday to Arnold. Justice for Arnold.
Reporting for Hot 7 News, I am Genevieve Gonzague.
Thank you, Genevieve. While there have been no pronouncements by the government so far as to the revised protocols which will guide the country moving forward, the St. Lucia Medical and Dental Association and some members of the public insist that a national shutdown is required. The Prime Minister has on many occasions said that shutting down the country will not be in the best interest of the economy. The business community says it is not an easy decision to make.
As of January 31st, 2020, St. Lucia has recorded 1,411 cases of COVID-19, 216 of those on Sunday alone. On Friday, stakeholders met with the National Emergency Management Organization to discuss St. Lucia's national response to the COVID-19 pandemic. But instead of hearing the Prime Minister's response plan this weekend, a statement was sent from the Prime Minister's office stating that the current protocols would extend until February 3rd and that NEMA would meet again on Tuesday. Businessman Evarista Jean-Marie says that clearly government has a difficult task ahead.
Closing the borders right now is going to be devastating for the hotel sector. It's going to be difficult to close and reopen, and I think many hoteliers are quite rightly very worried about the business just collapsing, and we need to be mindful of that. Luckily for us, the decision has been made in terms of shutting the borders, because right now we can't get people out of the UK and Canada, and then we are only left with in the main US visitors. What I think the government needs to make is a few concessions immediately. They need to institute that second test and have visitors to those hotels being tested by at least the second day of arrival. That has to be done, irrespective of whether they need a test on their return to their country of origin. You need to have a second test.
Accountant Richard Peterkin, however, says it's a day-by-day decision as to whether or not government needs to impose a national shutdown.
If you look at the states which went through this in December and January, their numbers are beginning to go down. England, which went through is under severe shutdown, are hoping that their numbers will start to go down. And it may turn out that a lot of this is due to that human activity around December, that is now beginning to translate, as well as the new type of virus that the one they worry about is South African, but the UK variant and whatnot. So I am hoping that, maybe in a couple of days we'll see it reduce. What the government basically asked for is 2 weeks. And after those 2 weeks, they would make a decision. I am pretty sure that if suddenly we found it was 400, 500 a day, government would dramatically change its tune. But Barbados, when they came out and they spoke about it, they gave everybody a week in order to go and arrange, get your food, do what you need to do. And so that was ample time. And I hope that if government is forced by the circumstances to do that they will give people sufficient time to ensure that they have what they need at home so they will not have to go out.
The NEMAC meeting called for Tuesday will further review the existing protocols, after which the Prime Minister is scheduled to update the nation of any new measures. For the Hot 7 News, Nisha Charles reporting.
You're watching the Hot 7 TV Nightly News. When we return, the religious community here reacts to a deadly shooting in a church in Jamaica, and the fire service continues to have its resources stretched.